Hello, listeners. Welcome to our podcast, Science with an Accent, where we bring you the latest and exciting findings in the field of science. As with every episode, today also we will be diving into three super interesting research articles. First up, we have Dr. Paul from Dr. Gerald Niznik College of Dentistry at University of Manitoba, who will be talking to us about dental trauma. Over to you, Paul.
Thank you very much. Everyone is vulnerable to traumatic injuries to their mouth and teeth, as a child playing at home or in the day-to-day life as an adult. In a series of recent guidelines co-authored by Dr. Hans Stasiuk from the University of Manitoba Faculty of Dentistry, prevention of dental trauma is discussed with excellent recommendations for all ages in life. The thorough analysis outlines steps to take to ensure people in different ages and behavioral categories can use to mitigate the opportunities causing trauma to their teeth. Infants are recommended to be supervised as developmental milestones can lead to tumbling off of furniture, while adolescents are encouraged to wear mouthguards during high-contact recreational sports. As a special consideration, the report shines a light on those with special needs that need more complex management who may struggle tolerating treatment should an accident occur. The opportunities for dental trauma every day are abundant. By following the steps and precautions outlined in this guideline, they will help reduce the chances of people having tooth trauma, the associated pain, and potential life-altering treatment, notes Dr. Stasiuk. The guidelines emphasize that taking small precautions and forward thinking can reduce the chances of having an accident. Although every accident cannot be anticipated and avoided, the robust recommendations outline the avoidance of mouth piercings and risk-taking activities like stunts on bikes as obvious ways to avoid damage. This report is the second in a 10-part series on dental trauma that includes sport-specific strategies, treatment of trauma, and education for the healthcare provider.
Thank you for the insight, Paul. So next up, we have Fola, who's a PhD student from the Department of Immunology at University of Manitoba. She'll be talking to us about new biology methods to study recycling in parasites.
Thank you very much, Meher. A breakthrough study coming out in the journal Nature Springer Protocol has identified a novel method to study a parasite responsible for a neglected tropical disease. This new biological method was identified by joint collaborative efforts by researchers from around the Faculty of Medicine at the University of Manitoba. With this new technique, scientists can study how this dogged parasite, Leishmania major, responsible for leishmaniasis in vulnerable communities, persists within the host. Using their proposed techniques, they can show how these parasites can clean house by getting rid of their waste material and how they recycle some of their contents for later use in a process called autophagy, enabling them to survive longer in the host and cause more diseases. The novel method involves strict systematic steps that must be followed with the aid of a high specialized high-tech camera called a transmission electron microscope and a color-linked device called flow cytometer. Dr. Said Ghavami, one of the brains behind the remarkable finding, highlights the importance of this novel method, stating, "This new method will advance studies aimed at understanding autophagy in Leishmania parasites and provides insights into improved therapeutic targets against leishmaniasis." Experts are hopeful that these studies can prove instrumental in combating this disease in endemic areas like Africa and South America. However, further studies employing advanced scientific technologies are still needed to seek out a lasting solution to eradicate the disease from vulnerable communities.
Thank you, Fola. That was very interesting. Finally, it's my turn to talk a little about how COVID-19 had an effect on prescription trends of antiseizure medications. So, we all know that the pandemic had a widespread impact on people with chronic diseases, such as epilepsy. Researchers at the College of Pharmacy, University of Manitoba, shared some extremely interesting insights on the prescription trends of anti-seizure medications during COVID-19 in Manitoba. This study was published in the journal Frontiers in Neurology in 2023. As we all experienced, the pandemic, especially the lockdown, had drastic effects on medical care, availability of supplies, access to medical prescriptions. In this study, the researchers, led by Dr. Sharif Altonsi, investigated the Manitoba Centre for Health Policy Repository, which is a provincial level population database. Around 1.3 million prescriptions were studied between June 2016 and March 2021. Alekia Lavu, the first author of this exciting study, says, interestingly, we found that during COVID-19, there was a small but significant increase in antiseizure medications prescriptions in Manitoba. Furthermore, there was a significant decline of 4.34% in incident use of ASMs. But why would there be a decline in incident or new prescriptions during COVID? Alekia adds, there was a reduction in access to in-person care during the pandemic, hospital restrictions, possibly resulting in impact on diagnosis of epilepsy. Importantly, this study highlights the broader effects of COVID-19 on the medication usage in case of other chronic diseases. There is a need to take steps to ensure a more consistent prescription plan even during drastic times of hospital restrictions, such as that we saw with the pandemic. So, wow, this has been a great episode where we hopefully all learned something new. So, folks, remember, keep being curious and remember that science has an accent.